Thank you. Thank you. Good morning.
Good morning.
All right. Let's see here. Okay. First of all, I'm going to echo Dr. Antebi, our great speech. Thank you guys. I mean, the reason that we hold this event, the actual reason that we're here practicing is for you. And without your trust, without you letting us into your lives, we wouldn't exist, our practice wouldn't exist. So I do want to just take a minute actually and really heartfelt thank you guys. It means a lot for you guys to let us, operate on you, to let us care for you, care for your family, and you trust us with what we do. So we really, really appreciate that. Second, I want to actually thank our staff, from our CEOs to our administrators to everybody else that is on the front lines. I mean, you guys know that when you come into our office. They're the ones who answer the phone, they're the ones who greet you at the door, they're the ones who walk you through each step, and they're the ones who call you afterwards and make sure that we did a good job on you. So I cannot thank our staff enough. We have a wonderful group of physicians. We do wonderful work and great providers, but we look good and we do a good job because of our staff. And so again, they really care for you and they really help us do it. I also want to take a minute just to thank our sponsors today. I do encourage each of you to take some time after the event, come up and look at the robot up here. There's another robot in the back room. These are some of the new technologies that we're doing and using to put in joint replacements. I'm going to touch on even some different technology that's coming along, so I think it's very interesting for you guys to actually see this. I think you guys can go up to the different implant vendors and you can see what may actually be in your body. You get a chance to actually touch the knee replacement, touch the hip replacement, feel how much it weighs. You'll be surprised it doesn't weigh as much as you think. And you think we'd gain you an extra 10 pounds, not really. So go feel the pieces. You will also see some of the other stuff that our pain doctors are doing. You'll see some pain pumps and some other resources that we have and use. So I want to just take a minute to give a round of applause for our sponsors. Thank them for this event. And please spend time with them. Another thing I want to touch on real quick, and many of you may not know this, I'm sure a lot of you actually do know this, but AVORS Medical Group actually has a family practice that is affiliated with us. And I'm sure a lot of you in this room actually have Dr. Susie Nasser as your primary care physician. But we actually have one of the most rapid growing family practices in this area. We have about 6 providers currently, and we hope to double that number over the next year or two. So if you are in need of a family provider, if you're in need of a general practitioner, please think of family first. The nice thing is that they are affiliated with us, so if there's a problem, we come talk to each other. We're upstairs and downstairs, we are across the hall, and so we can talk about your needs. We can address things. They have instant referral ability. They can send you right over to us. And so, they're just a wonderful group of providers. They provide some of the best medicine and care that you will receive. And so it's important to know that they're available for you. In addition, AVORS Medical Group has our own surgery facility. It's up on our 3rd floor of our office building. Many of you have probably had your procedure there. But it's called Embassy Surgical Center. And so again, it's a state-of-the-art facility. It has 4 different operating rooms in there. It's amazing staff that run it and take good care of you. For those of you who have been there, you're the testimonies to that. They do a wonderful job there. So again, some of the services that we offer that you may not know. And it just goes to show again how much our practice is growing, some of the great providers we have and the wonderful staff that is allowing us to do this. So moving on, I'm going to talk quickly. I'm not going to bore you with a lot of things. I just want to touch on some things about the shoulder itself. And the reason I do all types of surgeries, as you've heard, I do hips and knees, we do trauma surgery. For some reason though, all my partners keep sending me all the shoulders. And so Dr. Antebi does shoulders as well. He actually operated on my shoulder recently. So you can see how good it's doing. So, I'm just kidding. But for some reason, I'm becoming the shoulder guy, and that's okay with me. I enjoy doing shoulders. I did a lot of sports medicine in my training, worked with a bunch of different professional teams when I felt like actually being on the sidelines. And since then, I just take care of a lot of athletes and general injuries in the shoulder, so I'm happy to take care of them. But we do everything, and you'll notice most of the providers in our practice actually do a fair bit of all general orthopedics, but we each have some interests and areas that we kind of specialize in as well. So on the shoulder, quickly, I just want to talk about a little of the anatomy, and this isn't to spend all your time. I know after breakfast, what you really want to do is look at anatomy of the shoulder, but I just think it's important that you see some areas that you're going to come and see us and what hurts, and there's different things that can cause problems in the shoulder. Most of these muscles, these big red things into the white tendon areas, these are what make up what's called the rotator cuff, and I have another picture of that to show you. And that's a very common thing that you're going to come see me for, is a rotator cuff injury. However, shoulder can also have problems with this tendon here. This is part of your bicep tendon. This big kind of area here, that is a kind of fluid cushion in there that's called a bursa. A lot of people will get inflammation or pain in there, particularly when they do overhead activities. There's different joints in here. Joints that can cause arthritis, joints can get inflamed and form bone spurs. And all these things are contributors to what causes shoulder pain. So when we see a shoulder, there can be multiple reasons why it hurt. And so I always get asked, what is the rotator cuff? And it is a group of muscles. This is looking at it from the front, and this is from the back. It's made up of 4 different muscles that surround and encapsulate the shoulder. And those are what actually help you move and elevate your arm to some degree. And so those are commonly, injured just with life, wear and tear as we do things at our shoulder level or above, or from some big injury that can occur, you can get damage to this. This is what arthritis can affect, the bones themselves. You can have the joint here in the shoulder is what we call a ball and socket. It's made up of the ball here at the top of your humeral bone and the socket part of your shoulder blade. Those rub together and let you move your shoulder. So you can have arthritis or other disease processes that affect that as well. So when you tear your rotator cuff, it looks something like this. The tendon itself has a tear over time, and so we have to address that. And that can be a source of pain, of limited motions, etc., etc. And so what are some things we do to address that? Well, one of the most common things you're going to have is some type of injection. And I put this in there for a couple reasons. One, because I wanted to talk about some newer treatments, but 2, because I want to talk about some of the classic treatments like a cortisone shot, which I'm sure you all heard of. Just out of curiosity, if you've ever had a cortisone shot anywhere in your body, raise your hand. Look at it, we all know cortisone, so we all have experienced it. And cortisone, for some reason, gets a very bad reputation. So I hear a lot of people come tell me, oh, that doesn't work for me. Oh, I've had it. Or, I'm not interested in that because it's just a Band-Aid. And so I wanted to clarify a couple things. Cortisone is actually a treatment that we use to help cure this problem. Okay? Cortisone is just a strong anti-inflammatory. If you imagine taking an ibuprofen or an Advil, it's the same type of medicine. There's ones that are called steroid anti-inflammatories and ones that's called non-steroid anti-inflammatories. So cortisone is technically a steroid, but it's just an anti-inflammatory. And so what does it do? We put it in there, and it kind of decreases the body's inflammation and pain response, okay? So it helps get that inflammation out of there. And even if it's been years since your injury, your body has formed some of this kind of chronic tissue that tried to heal but maybe didn't complete the job. And the cortisone medicine gets in there and kind of helps get that out of the way. And by doing that, it wakes your body's healing mechanism up to say, hey, go fix this problem, okay? So it can cure you. Now, the bad rep of cortisone is that sometimes it can't. So sometimes you have this, you feel better for a little while as it's having some anti-inflammatory effect, but then, the pain's still there, it didn't make you better. And sometimes it doesn't heal it. The other thing you'll hear is that you'll hear that it can have some side effects, meaning it can destroy or damage tissue. And it can if it's used incorrectly. In the old days, we We used to put cortisone in anytime someone just, said hello, okay? They would come in, they could come in every week and we'd put another cortisone shot in. I mean, we didn't do that because we're good doctors, but it was done, okay? So, cortisone, if it's used incorrectly, if it's done in the same area of the body too frequently, it can actually damage the tissue. The medicine actually can break down cartilage, break down tendon tissue. And that's where some of this bad reputation came. It was, used incorrectly, abused to some degree, and it can cause some damage. So, again, I just wanted to clarify that when you come see me and I offer your cortisone, know that I'm actually really trying to help you, okay? So there is some newer things. A lot of people have heard of stem cell treatment. One variety of that is what's called platelet-rich plasma, or PRP is what we call it for short. And there's a quick little diagram, I don't know if you can see it good, of what platelet-rich plasma is. It's where we actually draw your own blood, so it's your own tissue, okay? And then we put it in a centrifuge to concentrate it out. And it divides the blood cells from some of the plasma and platelets. And in the plasma and platelet area is all your healing growth cells and factors, okay? The stuff that helps you heal. And so we draw that off into a syringe and then we inject that in different areas. And what does that do? Well, it does a little bit of what like the cortisone does. It takes away the inflammation. But then it actually has all your body's healing factors and cells there to try to assist in healing it. And so stem cell is the same type of procedure, but we usually take that from your hip or pelvis area here, and it's a little bigger of a procedure. But the goal is we're just trying to get some of your body's own healing cells to the area that it needs. And these are some of the best non-surgical treatments we have. In a lot of the cases, they can be up to about 80 to 85% effective to treat some of these tendon injuries and even some arthritic disease. Now, one thing you're going to hear is stem cell or PRP is not going to cure your arthritis, okay? I see a lot of people come in and they've got bone-on-bone arthritis and they want a stem cell or PRP treatment. Now, I'm going to give it to you because I want to take your money, but it's not going to help you, okay? And as you've learned from us, we're not going to do that. We try to actually practice good medicine, and we try to tell you if it's going to help you or not. And it can help slow down the breakdown of your cartilage tissue, can help slow it down, and in some cases, it's been shown to try to encourage the regeneration of it. So it is a very effective treatment. It is something we use, but it's not, a magic drug that's going to cure everything, okay? I'm a very big fan of it. I've had it in multiple areas of my body. I think it can do wonderful things. I think it's a good option. Unfortunately, for those of you who have had it, I've learned that, most of this right now is not covered by insurance. It's still considered somewhat experimental, and the FDA hasn't fully approved it. It's becoming that. Certain providers are starting to cover some PRP now. So it's a cash pay thing. So again, that's why we use it, but we also want you to understand it because it is your money you have to spend for it. So, but a very good treatment option we have. So what do we typically do if we try these treatments and they can't heal you? Then we get to surgery. So the top is a little diagram of how we put it together. We usually take some suture material, take these devices that look like little screws and put them in the bone. And many of you out there have this actually in your shoulder right now. So this is when we try to sew that tendon back to the bone. These pictures below are actually inside the body. This is what it looks like. This is the torn part of the tendon. This is the top part of the humerus called the humeral head. And you can see, we can see through this big space here, this hole. And then when we sew it together, this tendon now covers that. You can't see it anymore. So that's what we do, and the vast majority of the time we do this through what's called an arthroscopic procedure, which is where we make little poke holes and we look in with the camera and do it. To be honest, it's pretty amazing that we can do this through these little poke holes. It's pretty amazing, but you can actually see better. We can do a lot of procedures. In some cases we have to make a smaller incision depending on different things we have to address, but this is typically what we do. There is a new procedure I want to touch on, and I am going to let you know that out of my group, I'm the only one who does this, okay? So that's very important you come see me for this. Dr. Intevi tried to do one the other day, but I put a stop to that. I'm like, no. He may do some too, we can do that. But in the valley out here, in the antelope Valley. I'm actually the only person that does this. I think the closest is somewhere outside of LA that does this procedure as well. But this is a unique implant. It's called an in-space balloon. And for the situation where I can't repair your rotator cuff, but you don't have bad enough arthritis that it's time to do a shoulder replacement, then we have some options. And this is a newer procedure, and so we used to not have many good options for you. And so this is actually kind of a temporary thing. It's not a full cure, but what it does is I go inside and I actually insert this little balloon into the space between the ball and the bone above where your rotator cuff normally goes. And I put this balloon actually inside here to act like a little temporary cushion. It's done through an arthroscopic procedure, through the little poke holes, outpatient surgery. A pretty quick recovery, about 6 weeks. And it's a good temporary thing. What the data has shown is that the balloon itself starts to dissolve away between about 3 and 9 months. But when it dissolves away, the body grows this scar tissue around it and kind of makes this little cushion back there. And that cushion lasts in that space for about 5 years that we know of right now. It hasn't been around long enough, so we only have about 5-year data. But it gives some pain relief, helps it function a little bit, and is something that we can do before we have to get to the next surgery, which is a much more major surgery. So again, something that AVORS and the fact that we try to stay at the cutting edge of innovation, give you the best things. You don't have to drive into LA to go to Cedars or USC to have this done. I mean, we're doing stuff like this right here in your community. Another quick problem that many of you have seen me for is arthritis. Okay, this is what arthritis looks like. The cartilage wears off where the ball and socket rub together. The bones start to touch. You guys know this from your hips, your knees, everywhere else. This is kind of what an X-ray looks like. So we have options like hip and knee replacements. We have shoulder replacements. We have a traditional replacement is where we go in and we cut off this damaged ball. We put this stem inside your bone with a metal ball on it. We put a little plastic piece onto your socket right here, and it gives a new ball and socket, lets you move it around, and takes away pain. This is done through a cut. It's a decent sized cut, even though we try to do it minimally invasive and small. It's a pretty big cut on your shoulder. It's still an outpatient surgery though. It takes about an hour to do. You go home in a sling right away. It takes about 6 weeks to recover, a few months to get back to everything. So this is again what we do for arthritis. Now, there is more and more people that come to me and they have an arthritic shoulder, but they also have a rotator cuff tear, very common. And we can't do this type of surgery without a rotator cuff to help this work. So what we do for that scenario is what's called a reverse shoulder replacement. It's where we actually change your body's anatomy. And I take the ball and socket, which looks like this, and I put them in opposite positions. So the socket goes here and the ball goes here. And that's what the X-ray looks like. And so what does this do? This not only helps the arthritis, but by changing the position, we actually change the mechanics of the shoulder. And we use this outside muscle here called your deltoid that becomes your new rotator cuff. And this is very good for helping you restore some of your motion and function as well as help your arthritis. Now, neither of these typically can I promise that you're going to come in and go like this, or that can get something off a high shelf. That does happen, okay? If you have me as a surgeon, that happens. But it can happen in some patients, but I don't promise that, okay? We hope that you can get to your hair, your mouth, and your backside, and have pain relief with activities of daily living. So that's what we hope, okay? So we can't promise you this, but these are some good options. A couple other quick things, and then I'm going to turn it over. I want, with this technology, with joint replacement, we are now using more and more new technology advances, such as these robots over here. Like hip and knees, they have this navigation of these robot-assisted surgeries for shoulder replacements, okay? And that allows us to have more precise placement of these implants, more precise restoration of your normal anatomy to help you have a better outcome with what we do. So again, take a look at these robots, you can see what we're doing. And there's some new technology I'm actually very excited about called augmented reality assisted surgery, okay? This stuff is already happening. It's just not fully available yet, but hopefully one day you're gonna see it here, us at AVORS doing this. But this is actually where we put on these headpiece goggles, like you see, like virtual reality, and they actually project your anatomy up in front of us, like Iron Man, okay? This is like right there, it's really cool. And we can see during your surgery how to put your pieces onto your bone, how to align it, how it moves, how we do this surgery. And we're doing it right in real time with this helmet on, or this goggles on, as we're looking at you and doing this. Like I said, this is brand new stuff that's occurring. It's happening in hips, it's happening in knees, it's happening in shoulders, and I think it's really going to be a fun game changer to help in the outcomes of future surgery. So yeah, so hopefully you'll be seeing that soon here at AVORS Medical Group. So on that note, I want to give one last shout out to my lovely wife, as well as to all the spouses of our partners. Without you guys, we cannot do what we do. You guys give us our support, you recharge us, you let us come home and complain, you keep us fed, and sometimes you drag us to the top of a mountain that you never wanted to go up. So, thank you guys, and with that, we'll turn it over. Thank you.
We call Dr. Sherfey the shoulder whisperer. One of the things that, because we're the only providers who are on call at the hospital, a lot of times patients will go out of town and they'll have procedures done. And when they come back, because the procedures failed or because there's a complication, they go to the hospital, and then we are the ones who provide the service. So when there's infections and things like that, we're the ones who take care of it, not the surgeons who cause the complication, or who for some reason, you go to your local hospital, they're not local people. So it's just a push to continue to stay local, and the reason why is you have very competent, skilled surgeons here, so there's no need to go to LA. And talking about that as well, I wanted to introduce Dr. Eric Awashi. He is probably our youngest fellowship-trained, board-certified orthopedic surgeon from Scripps from San Diego. And a lot of his techniques that he's learned are on the knee and the hip. And we wanted him to come talk about the total knee replacement and some of the things that we can offer here in the Antelope Valley, either at Antelope Valley Hospital or at Palmdale Regional. So Dr. Awashi.